Type 2 diabetes is a complex chronic illness. Patient education and support are important in achieving and maintaining glycemic control, preventing acute complications, and reducing the risk of long-term complications. The American Diabetes Association has taken the lead in the development and dissemination of diabetes care standards and guidelines. In its most recent Standards of Medical Care in Diabetes, the ADA recommends that clinicians use a patient-centered communication style that incorporates patient preferences and addresses cultural barriers to care. Treatment decisions should be evidence-based and be tailored to individual patient preferences, prognoses, and comorbidities. Care should be delivered by a prepared, proactive care team and an informed, activated patient. The ADA recommends well-developed tools to facilitate effective decision-making. As diabetes progresses, it frequently becomes more difficult to maintain adequate glycemic control on a single agent such as metformin. Additional medication may need to be added to a patient's regimen. For patients, decisions about additional treatment are difficult because of the many medication options that are available. Often patients are not even aware that they have a choice amongst these treatments. As the decision is considered, clinicians and patients need to consider that medications vary in effectiveness, dosing, administration convenience, risk of adverse events, and cost. There are trade-offs that must be made amongst these factors. Patients' inadequate, incomplete, or incorrect knowledge of the benefits and risks of these options can impede informed decision-making and ultimately affect the desired clinical outcome. This can result in patients delaying or making ineffective decisions, such as starting on a medication that may not align with an individual's circumstances, preferences, or values. In this issue of the Journal of Patient Preference and Adherence, we describe the development of a patient decision aid, a PDA, to facilitate patient understanding of diabetes treatment options. We also describe the cultural and linguistic adaptation of that decision aid for a Spanish-speaking audience. The PDA was developed by a multidisciplinary steering committee of clinicians using a systematic development process. We included input from practicing clinicians who provide care to English-speaking and Hispanic patients. We also included input from patients during initial development and during the Spanish adaptation process. The PDA includes information for patients based upon evidence-based literature, and we designed the aid for easy integration into clinical practice. Content is delivered online over the internet and can be accessed either in the physician's office or at home prior to a face-to-face clinician consultation. The PDA explains to patients the choice that has to be made regarding additional medication and compares treatment options. Evidence about the risks and benefits of different treatments are presented. A summary section shows patients a fact sheet that compares the risks and benefits of medication classes side by side, both verbally and graphically, in an unbiased manner. To help patients understand what's important to them as they consider the options available, the PDA includes simple questions that assess patient values and preferences related to treatment effectiveness, side effects, route of administration, impact on body weight, and cost. The PDA is interactive and that it communicates expressed patient values and preferences back to the clinician in preparation for a clinical consultation medication decision. Patients with poorly controlled type 2 diabetes on metformin who are at the point of considering additional medication assess the decision aid during a pilot. Patient response was positive, and feedback from clinicians confirmed that both they and their patients with diabetes value the use of the PDA for decision-making. Based on this feedback, it's likely that the PDA supports the diabetes decision-making process. Effectiveness of the PDA is being further explored through an ongoing validation study. The PDA is available at www.diabetesdecisionaid.com.